Your name is Kyler, and you consent to do my health assessment checkoff?
Yes.
Okay, thank you. Hi, my name is Nikki. I'm going to be taking care of you today.
Hello, my name's Kyler.
Hey, so what brings you into the office?
I'm having some ear pain.
Okay, which ear's bothering you?
My right.
How long's it been going on?
About 2 days.
2 days. And what does it feel like?
Kind of like a burning/ache.
Okay, where at in the ear is it?
Kind of like the inner ear.
The inside?
Yeah.
Does it go anywhere else, or it just stays right there?
Just right there.
And the outer part feels okay?
Yep.
Okay. Did you do anything to it? Hurt it? Anything you can think of?
Not that I can think of.
Okay. Are you having any other symptoms with it, like a runny nose or a sore throat or headache?
A little bit of a runny nose.
Okay. How long have you had the runny nose?
About 3 days now.
3 days. Okay. So the runny nose came first and then the earache?
Yes.
Okay. Is anything coming out of your ear at all?
No.
No. And what does the drainage look like that's coming out of your nose?
It's pretty clear.
Okay. If you had to give that pain in your ear a rating, like a 0 to 10, 10 being the worst you've ever felt, what number would you give it?
7.
A 7.
Yeah.
Okay. And does anything make it better or worse that you've tried?
Nah, it's pretty constant.
Have you tried anything to help the pain?
No, it just was coming here to see if I could get something for it.
Okay, sure. And so you haven't tried anything at home?
No.
And it doesn't really go anywhere?
Correct.
The runny nose started first?
Yes.
Okay. All right. What is your past medical history like?
Pretty healthy.
Pretty healthy? Okay,
Yep.
so if you had to guess what was going on in your ear today, what would you say?
Had an ear infection one time, so I'm thinking that's it.
It feels like that?
Pretty similar.
Okay. Did it get better?
Yeah, after they gave me some I came to the doctor, they gave me some medicine.
Okay, so that helped it.
Yes.
All right, so you really don't have any significant medical history, no
Uh-uh.
cancer, diabetes, high blood pressure?
No.
Okay. Anyone in your family have any history?
My dad has high blood pressure.
Okay. All right. Any surgeries or hospitalizations for you?
No.
Okay. Any allergies to medications or any environmental stuff, foods?
None that I know of.
Okay, great. Do you take any medications every day?
Just vitamins.
Okay. And you haven't tried anything to help with the pain, so really no over-the-counter stuff too often?
No.
Okay. And you said you've taken antibiotics in the past with no problems?
Yes.
Okay. All right. Any other problems today, like no chest pain, shortness of breath, no belly pain?
Nothing, no.
Any changes in your bowel habits?
Nope.
Going to the bathroom okay?
Very regular.
Okay. All right, great. I just have some general questions for you about like the rest of like kind of social stuff and outside of the office before we get started on your assessment, okay?
Yep. Yes.
Do you work?
Yes.
What do you do?
Firefighter.
Okay, awesome. Do you live at home?
Yes.
By yourself?
Wife and 2 kids.
Wife and 2 kids,
Yes.
Great, okay. Any like significant new stressors or anything?
Just the normal.
Okay, typical life.
Yep.
No psychiatric history at all?
No.
Okay, and you feel safe at home?
Yes.
No one's hurting you?
No.
You don't feel like hurting yourself or
Nope.
anybody else?
Mm.
Okay, no problems getting food or
Nope.
anything? Okay, great. Do you smoke?
No.
Any drug use?
Nope.
How about any alcohol use?
Socially?
Okay. It seems a little personal, but it's just part of the interview questions as well. How about your sexual health? Everything seems normal?
Yes, as far as. Yeah.
Okay, how many partners?
Just one.
Okay, and no concerns for any infections or anything?
No.
Okay, great. Thanks for answering those questions.
Yep.
I know it can be kind of odd. So what I'm going to do is wash my hands and then we'll go ahead and start your assessment, okay?
Yep.
Okay, so first thing I'm going to do is start with the top of your head. I'm just going to kind of check your whole head out and I'll get to like your ears, your nose, your throat, and your eyes and everything, okay?
Yep.
All right. So your head is normal shape, symmetrical, no lumps, bumps, bruises. Your hair is evenly distributed, normal, like fine texture. Any tenderness along the back of your neck?
No.
And no tenderness along your neck or throat at all?
Nope.
Okay. All right. I'm just going to go ahead and feel your lymph nodes, if that's okay real quick.
Yes, it is.
Got your preauricular, your postauricular, your posterior cervical, your deep cervical chain. Got your tonsillar, your submental. You've got your supraclavicular right here. Everything feels good. Nothing's inflamed. No concerns. Everything's moving the way it should, okay?
Yep.
Can you go ahead and hyperextend your neck a little bit for me here? I'm just going to feel your trachea. Everything's midline. No tenderness.
No.
Can feel your thyroid. Everything's moving good. I'm going to go ahead and assess your range of motion real quick. You're
Yep.
moving back fine, but could you tuck your chin to your chest for me? No tenderness?
No.
Okay, and can you do ear to your shoulders, both sides? That feels okay?
Yep.
Great. I'm going to check your jaw for any like TMJ issues. Can you open and close? And kind of rock it side to side for me. That feels okay?
Yep.
Wonderful. And there's no clicking. Everything feels
No.
good in there. Great. Okay, so I'm going to go ahead and start your ear assessment if that's okay. I'm going to
Yep.
use my scope here and just kind of take a look. So you'll feel me kind of pull up and back. Okay, your outer ear looks great. No lesions, no swelling. Your inner ear looks fine. I can see your tympanic membrane. No swelling, no erythema, no redness. I'm going to check this side, the problem side, okay?
Yep.
Okay, you've definitely got some swelling to that tympanic membrane and some redness throughout, so you're probably right. I'm sure you do have a bit of an ear infection going on in there.
Oh.
Okay. So how's your hearing?
It seems normal.
Okay, I'm going to do some quick hearing assessments with you, okay?
Yep.
I'm going to use my tuning fork here.
Yep.
What you'll feel me do, I'm going to kind of tap it on my forearm to
Yep.
start a vibration. And then I'm going to touch the back, this bone right here, flat bone, and what I want you to do is let me know when you can't hear the vibration anymore, okay?
Yep.
And when you can't hear it anymore, I'll then hold it in front of your ear, and same thing, let me know when it stops. Okay?
Yep. Okay. Okay.
All right, and other side.
Okay. Okay.
All right, great. That's normal ear conduction that lasted longer versus the bone, so that's wonderful. Okay,
Yeah.
that lets me know that your hearing isn't being affected by that infection over there. I'm going to do another one. It's called the Weber test. That was the Renee test, okay?
Yep.
The Weber test is where I kind of take it, again, tap it on my forearm, and I'm going to put it right in the middle of your skull, and I want you to let me know which ear you hear it in, okay?
Okay. Yep. Both.
Perfect. Great. Okay, I'm going to continue looking at like your mouth, your nose, and your eyes, okay?
Yep.
All right, can you open up your mouth for me? Great. Stick your tongue out. Okay, mucous membranes are moist. Can you say ah? No redness to your throat. That's good. Your tonsils are normal size. Okay, mucous membranes are moist and pink here too. I'm going to go ahead and just set this down for a second. I'm going to pull your eyelids, your lower lids down so I can take a look at your sclera inside your eyes, okay?
Yep.
Okay, that is pink. Conjunctiva is pink, no drainage. Your sclera is nice and white, which is wonderful. I'm going to do a quick assessment with your vision here, okay?
Yep.
So first thing I'm going to do is a pupillary response. You're going to see me, I'm going to flash a light from both sides. I'm going to check the assessment and the reaction of your pupils, and then we'll do a few more eye tests, okay?
Sounds good.
All right. Good job. Okay, pupils are equal and bilateral with reactivity. That's a good sign. So what I want you to do is follow my finger. I'm going to check your eye movements, okay?
Yep.
We're going to go up. And I'm going to go forward here. Great job. Okay, no lid lag, no nystagmus noted. Both eyes are responding and moving parallel. That's perfect, okay?
Yep.
All right. So I'm going to put down the scope. I'm going to grab my ophthalmoscope and I'm going to take a closer look at your inner eye, okay?
Okay.
All right. So first thing I'm going to do is darken the room.
Yep.
And then I'm going to set my diopter to 0, and I'm going to start assessing your inner eye.
Sounds good.
I'll start with your left eye, and then I'll go over to your right eye, okay?
Yep.
And use my left hand to take a look in your left eye here. Got to get really close. Just take a look right over my shoulder, okay?
Yep.
Okay, perfect. And you've got a red reflex on that side. That's great. I'm going to check this side. Okay, perfect. Red reflex on both sides. I don't see any opacity, so that's a really good sign, okay?
Good.
You have no concerns with your vision at all?
No.
Okay, I'm going to turn on my lights again. I'm going to do a quick visual assessment of your acuity, okay?
Yep.
So I'm going to hold up this paper. I want you to cover one eye. You don't wear glasses or contacts,
No.
right? Okay. I'm going to have you cover one eye and read the lowest line that you can.
A, B, C.
Great. Can you switch eyes for me?
A, B, C.
And look at it with both eyes?
A, B, C.
Okay. No blurriness. Everything seemed
No.
to be in focus.
Correct.
Perfect. Okay. And you're seeing colors normally. No concerns there?
Yes.
Okay. So I'm done with your ear, eyes, nose, and throat. What I'm going to do is make sure that your skin looks good too, if that's okay.
Yep.
All right. So I'm going to do a quick scalp assessment, and then I'm going to check just your skin on the front and back. Okay.
Yep.
Did we look in your nose?
I don't think so.
Okay, let me do that real quick. I think that I said I did, and then we'll check it. Okay. Let's look up. That looks good. Your septum's medial, nothing's deviated. There's just a little bit of that clear drainage, not too much. Okay, sorry, I forgot about that. And you're not having any tenderness throughout your sinuses, right?
No.
Okay.
Like
great.
it's mostly just that ear pain.
Yeah, and just that drainage, huh? Okay, all right, great. Thanks for that. Didn't want to skip over that part. Okay, so we're going to start with your scalp, okay?
Yep.
Just parting your hair here. Everything looks really good. No lesions, no rashes. Like we said before, your hair is evenly distributed. I'm going to go ahead. So I've looked at some of your skin just with my other assessment, but I'm going to take a little bit of a closer look, okay?
Yep.
I'm going to kind of pull down here. Yep, conjunctiva looks good. Upper lids. Okay, everything looks great. Your eyelashes are normally distributed. Everything's kind of pointing in the same direction. I don't see any swelling or redness anywhere. You're not having any drainage to your eyes or itchiness, right?
Correct.
Your sclera is normal color. We already checked your pupil response with my light prior. Okay, I'm going to check your mouth a little bit closer, okay? Both sides look good. You don't have any sores or anything inside that you're concerned about. You're eating, chewing fine.
Correct.
Okay, all right. And pull this down. All right, mucous membranes are still moist, pink, and no problems. Okay, so if you don't mind, can I have you remove your shirt?
Yep.
If you're comfortable with that, I'd like to take a look at your back. Okay, you've got normal skin, I know my hands are very cold, I'm sorry. Normal skin temperature, you're warm, dry. Are you having any concerns with any moles or bumps or anything that you've seen in the past?
No concern. I had one removed, but
I see that, the scar right here.
Yes.
Okay, and did they biopsy that?
I do not believe so.
They just got it taken
I
off?
think this removed.
Okay. Have you ever noticed this one right here on your left shoulder?
Yeah, a little bit.
Okay. Has it changed at all?
No, it looks pretty similar.
Okay, so I'm identifying a small nevi. What I'm going to do is kind of talk my way through a quick assessment, okay? I'm going to use the ABCDE method to kind of let me know if there's anything I should be concerned about. There's no asymmetry, it's symmetrical, your borders are clear and identified. It's normal, like light brown color all throughout, there's no color variations. It's probably 3 to 4 millimeter in diameter. It's pretty small. You said it hasn't really changed or gotten any bigger.
No.
Okay, keep an eye on it since you have had one removed before. Just let me know if anything changes with that over time, okay?
Sounds good.
All right, you can take a seat. I'm going to take a look at your front here, if that's all right. Okay, no concerns. Everything looks good. I'm going to lift up this arm. Okay. I don't really see any other spots that are concerning. Go ahead and take a look at your hands here. Again, normal color and texture, warm and dry. You've got good capillary refill. Your nail beds are pink. You've got no calcifications, nice round fingernails, no clubbing noted. You haven't had any concerns with your nails at all? Okay. I'm going to check you. It's called your skin turgor, okay? I'm just going to kind of pinch the top of both hands. And that went right back down, which is a good sign. We're checking for your hydration status. There's no tenting, so that's great, okay? I'm going to go ahead and check like your legs and your feet real quick, okay?
Yep.
No concerns with your legs?
No.
Okay, and your feet look great. Good capillary refill, no lesions, nothing's open. No itchiness or any problems that you've noticed?
No.
Okay, and your same thing, no clubbing. Your toenails look great. Everything's intact. Okay, everything looks really great. Do you have any questions or concerns for me today?
Not today. Just am I going to get medicine or?
Yeah, we'll definitely be treating you for an ear infection on that right side. And then I want you to call and get a follow-up with us so we can make sure that what we give you is helped, okay?
Okay.
Keep an eye on that nevi on your left shoulder blade, and if anything changes or you have any other questions, feel free to call us, okay?
Perfect.
All right, thank you.
Sounds good. Thank you.